Thank you so much. We do have a few minutes if we'd like to take a couple questions.
We do have time for some questions. Evelyn, did you?
Opening up to the community in the room and outside if you have any questions for Jim. And if you-
Dr. Campbell, do you want to start us off?
I'll be happy to. I just wanted.
Could you please go to a microphone?
Yes, I will. Here's one. Oh, thank you, Kim. I wanted to, first of all, thank you very much, Jim. And I've been plowing my way through the World Health Organization follow-up report, and I indeed recommend it to everyone. It's free, online, and a very important report. But I wanted to ask you, in terms of gender issues, are there different patterns for women? You showed the women's rates of homicide and suicide. But in terms of prevention strategies for homicide of women and suicide of women, my observations have been that there are different strategies we need to take, and I wondered if you could comment on that.
Of course, I could ask you the same question, couldn't I? Yes, of course there are. I mean, firearm homicides involving women in the United States occur under different circumstances, generally speaking, than males. They occur in the context largely of intimate partner violence. And so the types of interventions we would want to use to address that underlying problem of interpersonal violence may be different than the types of interventions we would address with youth violence that occurs in cities and on the streets. So very clearly there are differences. But, you know, we're learning a lot more about how to prevent those things and as well. I pointed to the laws regarding disarming batterers, which I think are important. But underlying violence, I just was at a presentation the other day around sexual violence, around bystander programs and the promise they hold, and the Green Dot program in Kentucky, which is showing dramatic results. And there's many other examples. We're learning a lot about to prevent these things. We can no longer say we don't have the evidence to take action. That's no longer an excuse for addressing, I think, almost any type of violence.
Yes, please come to the microphone and identify yourself.
Thank you. I'm Dr. Betty Lee Davis. Can you hear? Is this coming across? Two questions, but I'll just preface it by saying I'm a practitioner and not a researcher. And the reason I'm here today and the reason my career, direction of my career interest has shifted in the last 7 years is that I've provided grief support to women who've lost children to violence in the city of Philadelphia, and for anyone who hasn't had occasion to sit in a room with a group of women primarily flowing in every week telling their stories, that will certainly signal the urgency of this problem because it hasn't gone away for them. But the two questions are, one, how, I guess, Jim Mercy said that this problem deserves the same degree of urgency as other public health problems. And one is, how does it get that same degree of urgency? And two, with the appointment of the Surgeon General who has an interest in gun violence, will that make a difference?
Well, I actually asked you guys that question. How do we get this at the same level of urgency as other issues? I think, you know, I think communications is really important. And so when I showed the faces of the children in Newtown and the teachers, I wonder how we can better make use of communication technology, communications to better keep this issue out in front of people. I mean, that's one area that I think we need to do a better job in. But there may be other ideas as well. We face this terrible problem of violence being as I say, we don't talk about it often, but being largely endemic. And endemic problems require a different response than epidemic problems. But I would open that up to other people in the room.
I'd like to comment directly to your question, given what you've offered as your work to help grieving mothers, is that talk to the people who organized Mothers Against Drunk Driving, because it was Mothers Against Drunk Driving, probably 20 years ago now, that really got the transportation industry off its duff and started paying attention to fatalities and started some of the laws around that we are all familiar with now. We forget that it was advocacy that got that whole movement started, not industry. So you wouldn't want, of course, to turn these mothers' grief and on a dime and ask them to become advocates, but nonetheless, there's some learning to be had from Mothers Against Drunk Driving that might come in and support those among them and others in other cities who would be capable and interested in advocacy after their grief.
Particular organization, Mothers in Charge, it is getting a national profile, and these women are advocates, and it was begun in 2003. I became a part of it in 2006, but they are out there fighting every day, letting people know. So there are those who are doing that. I guess my question, it also follows on Jim Mercy's. I had the pleasure of meeting with him recently in Atlanta when I was there, and so he's aware of some of the questions I have. But how does, for the part of the population where this is in the clustered areas, I would assume rises to the level of an epidemic, how does it get treated in those areas like an epidemic? Who can declare that and treat it in the way that Jim Mercy was saying, just like Ebola? Ebola hasn't required, at least for the immediate intervention studies or advocacy, it's had to be on the ground. And how can that happen in these communities where there's bloodshed every day in small geographic areas?
Comment, Dr. Hoosman?
Jim, a wonderful presentation, terrific. I've been thinking about persuasive communications. I often speak to PTA groups about video violence, and often what persuades people most is not kind of dry scientific evidence, but some really neat graphs. And the two you presented in the, I think it's the Wintemute, the new paper, are very, I think would be very compelling to present to organizations. How do you explain that violence in general is relatively low in the US compared with other countries, but firearm violence is off the chart? I mean, I think that's a great persuasive communication. And I'm trying to imagine objections to it, and so now I have a technical question. The assault data that Wintemute presents, is that from victimization surveys or is that government reports?
Hi, I'm the tech guy. Those are by self-report. In the last 12 months, have you been assaulted or mugged?
Victimization.
Yes.
Thank you.
One final question before the break, the lady in the black and white.
I'm Julia Silva with the American Psychological Association. Hi, Jim. I have just a comment. When we talk about the urgency that we all feel and we are trying to act on that in terms of taking the science to the field and helping those who are there dealing with those cases and situations and interventions every day. So I think that one thing that is very important is the collaboration and the meeting of research and policy people, and then how we can help connect those things. Because, when we go and see what, Jim is talking about, it was, France was saying, I mean, it's advocacy. So how can we, based on the science that, you guys here produce, helping us who are the intermediators and the disseminators of research to make it that this goes to the right people? So part of this is what you're saying is how are we using the research that, is so rich, so important, all the knowledge that Jim is talking about that we know a lot about what works, what can be done, and how can, all of us together find the mechanisms and ways to take this to those who are using it and also to those who are making policy. So many of us in the world of the professional associations like myself and Evelyn and other people. So how can we be instruments of that transmission and making that the urgency gets to everybody? I mean, to the families, to the victims, to the perpetrators, and to the policymakers. So that has been my question to the forum in some discussions is how can we move in terms of helping us to send this and take it to those who are in need of this knowledge. Thank you.
Thank you. That sounds like a whole line of research in and of itself, is how to take the facts and get people to act on them. I don't know if the panel wanted to respond specifically before we break.
Just one sort of addition to what you're talking about. Another line of research is how do we implement and scale up what we've learned? And that's a big challenge for us. I think that to me is the new frontier for violence prevention. How do we take what we know and get it used and disseminated widely and applied in an effective way? So thank you.
Thank you. It's now about, I guess, 18 after 10. Let's break till 10:30 when we'll return, and Peggy Murray will moderate a session on alcohol and the lethal means of violence. So 10:30, please be back in your seats.